Hello, how are you? Sakina, how are you doing?
I'm doing well. How are you?
Good. I'm noticing a little bit of like greenery in your background that I kind of love.
Yeah, I have so many plants. I don't know if you can see more.
Oh my gosh, I didn't even see those.
Yeah, it's a lot of plants. It's like a forest inside.
That's awesome. So I thought I was doing good because I have like, there's like three.
Okay, you are doing good.
Well, also, I'm a fraud because one of them is fake. So,
Oh, okay. This whole situation is fake.
okay, cool.
So
I don't feel
you're
as
fine.
bad now, but yeah, there's one that's fake. I'm not going to tell you which one. Maybe that'll be like
Uh-huh.
a fun game. Um, But yeah, I'm excited to talk to you um, because I wanted to talk a little bit about working with survivors of abuse and what that's like. I
Mm-hmm.
feel like we talk a lot about abuse and mental health, and we talk a lot about what it is and all this stuff. But what does it look like for somebody coming out and recovering from this thing? But before we jump in there, I want to ask you just a little bit about who you are, where you went to school. Are you what group are you with? Are you with the marriage and family therapists? Are you with the LPCs? Are you with the LMHCs? Where do you land on the kind of like the clinical spectrum, and also just a little bit about I don't know about you and who you are.
Yeah. So my undergraduate degree is in Africana Studies with a concentration in African American Studies. And that is what drove me into kind of like social justice oriented work. And so I got my MSS, which is like the MSW equivalent, from Bryn Mawr. So I am a licensed social worker.
Okay, you're the social work team.
Yeah, the social work team.
We love that. What was it that was there something that really pushed you towards that when you were maybe going into undergrad or when you were going into graduate studies? I don't know, what was kind of pushing you to say, "I'm really interested in this topic, I wanna do this?" Or was it something that was just kind of innate in you that you were like, "I really just wanna do this thing?"
I think I initially went into social work because I was interested in community organizing. And I'm still very interested in it, but I think in a different way. I didn't want to go to school for it any longer. I kind of wanted to be a part of grassroots organization and learn to like mentorship. Um, and then I took like a theoretical perspectives class because I love theory, I love learning. And I was like, ooh, I like this theory. And I like the micro lens because I was so used to doing macro work. And I think what's interesting about social work, I feel like so many people are doing macro social work and they don't know it. And so I was doing that already, and I was just like, I really like the theory and like the practice. That theory is supposed to be practiced. And so that, and I just also like relationships. I like relating to people. I like listening. I like attempting to understand. And I feel like I'm a pretty empathetic person. So I feel like it felt like a natural transition to move towards the therapeutic work.
Can I ask you really quickly, what goes on in a therapeutic or in a theoretical perspectives class?
So there is because social workers, we love to call ourselves eclectic because we literally are. But it's just such an overview of all of these like different theories, from like a systems theory, a psychodynamic theory, CBT. Like it's just an overview of theories and it just developmental theories. And so it just gave me just a glimpse into like what is happening for people on an individual, but also to some degree a collective level. And that just opened my world in a different way.
I love that. I'm curious if we could move a little bit into like your clinical work. How does because you kind of if I can like relate it to that to just like an overview of all of these theories because of course in psychology and in mental health there's so many things there's no exact combination of things that work for
Yeah.
people or even groups of people. I think how did that influence of really understanding theories in general, how does that impact your clinical work when you're working with an individual, if it
How does
does?
how does theories impact it? I think for me, because I'm not using one theory or one perspective, like you also were mentioning about just therapists in general don't. But I think it brings the theory to life and also I feel like I'm always pivoting because I don't think any client fits into one like perspective, and so I'm pulling from so many different theories to try to also understand what's happening, what's happened to this person, and how it's impacting their present life. And so I think it comes up it comes up in everything, like from attachment theory, understanding their primary or their initial attachment relationships, to psychodynamic theory when I'm going backwards to understand their early experiences, to also like trauma informed, to also understand that people are coming to me likely with a trauma history, and that there's a way to engage that can minimize re-traumatization.
What is it? Well, actually, I want to ask just a quick side question. What is the population that you typically work with now? Who is your typical? I guess typical isn't a fair word when we're talking about humans, but like, what does your client look like? What kind of issues are people coming in when they're seeking out working with you?
So the issues that a lot of clients are coming with, it's a lot of shame, I'm noticing, a lot of guilt, that is like consuming. And so like depression, anxiety. I've had a lot of clients with OCD, PTSD, complex trauma, um, gender dysphoria, gender identity disorder. Like a lot of, because I work a lot with primarily with TGNC folks. And so I think that that is a lot of the issues that clients are coming to me with.
So when you're working with an individual that's embarking on this journey, my assumption is that you're going to get people that are at very different places.
Yeah. Yes, 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 yes.
I'm wondering where I have so many questions. I can't even like think of one. I'm I'm thinking
Uh,
of like where where is the typical starting point with somebody when they're coming in that first session and they're saying, "This is how I'm feeling."
mhm.
What does that look like? What is I don't know. I'm just gonna shut up, and because I have so many questions and I'm so curious that I feel like I don't even know where to start. What does that session look like when they're coming in to
Mhm.
work with you
Uh,
about their identity and about who they are and how they express themselves? Um,
mm, mm.
yeah, with gender, sexuality, things like that.
Yeah, so I'm very much about the relationship. And so when they're coming in, I am also focusing on building that trust and safety. And so I have this whole like structure of at least our first session around like transparency, around what to expect. And I also began with this question of like, what makes you feel safe? What do you think I should know about you that could help you feel safer? And a lot of clients are really shocked by that question. They're like, I never had this question before. And I have a lot of clients who've been in therapy before. And so I think it's about building the safety regardless of identity, because I don't necessarily know these clients' trauma histories, and their experiences. So I feel like building that foundation of trust and open communication and collaboration, and folks feeling like they are an active part of their healing process, feels essential to doing the work, but also creating safety, because I think that's also something really important to me.
What does safety mean to you? What makes you feel safe?
Uh, I think transparency, I think open communication. I'm gonna like I feel like all the things that I think research has said makes people feel safe, but I think feeling that I am a part of the process, feeling that there is a mutuality, there's a connection, and empathy. I think empathy at its core uh makes me feel safe.
Mhm. Um, I want to shift into working with survivors of abuse for a little bit
Okay, okay.
because this is something that you work with.
Yes.
So, mentioning in the first session what makes you feel safe is obviously incredibly important because we know that like working with anyone with a trauma history, that there has to be safety in the session. We have to feel comfortable talking to each other, and we have to feel like no one's going to hurt me here, whether it's psychologically, physically.
Yeah.
What does that look like when you're coming in with a client that is saying, "This is my history. I want to work on this." Are there some ways that maybe some defensiveness might show up in session? I'm curious about how it shows up, and I'm curious about how you show up with that in the session with the individual.
Hmm. Wow. I think one of the things I've noticed is that a lot of the clients who are abusive, well, I think most of my clients, 80 to 90% of the clients I've seen over the past 3 years have been survivors of abuse, different forms of abuse. Like they aren't entering with that being their presenting problem. It's unearthed or revealed as we connect. And sometimes in different placements I was in, it was through assessments. It's just readily revealed. But I think it informs all of the work and their experiences. And so defenses I've seen a lot. There's denial, there's projection, there's passive aggression, um, and there's repression and displacement. Those are, I think, the defense mechanisms I see a lot. Um, and I think for me to name the abuse, it depends on what the client wants also, how they want to engage this experience. Because one of the first questions I also ask in the initial session is like, we're going to delve into trauma history at some point, but it's up to you to decide if or when you want to disclose. And so it's always this uh, choice whether or not they want to. And I think what feels also important in doing the work is also acknowledging behaviors. Naming that that's abuse doesn't necessarily always land well. Some clients are distressed by that because it's the first time sometimes that they're thinking of their relationships like that. And so I name behaviors. And so I think that feels like a gentler way to be able to have the clients also engage with their experiences. But with these defenses, I feel like what feels really important is supervision. Because sometimes in session it's like, whoo, that was hard. But I feel like I'm a very calm person. And so I'm able to like regulate myself, but I am experiencing it. So after session, I I will speak to my therapist if they're a therapist. Ooh, I speak to that. I speak to my therapist as well.
Right.
But my supervisor about things that come up in the room, and my supervisor is very oriented towards like the clinician of like supporting the clinician. And so will ask me what was happening for you in this space, and so we delve into what comes up. So I think
You bring up something really interesting, and it like shot off so many like light bulbs in my head. I It's interesting talking about denial as a defense mechanism. That's something that was coming up for me because I feel like one of the questions that I wanted to ask you and to go into a little bit was, how do you deal with denial, or how do you deal with someone who genuinely doesn't know that what they've
mm,
experienced is atypical or is not normal or is in some situations like unacceptable? And I bring this up because I'm in my clinical internship right now. So all of these things are
mm,
very new.
mm,
And it's really interesting hearing an individual describe something that to me, um, clinically, I am aware is what they're describing as abuse.
yeah,
And that can be a really hard word for people, right?
yeah,
I don't think I would say directly to a client, "Oh, you've been abused." I think that it maybe a different way of phrasing it would be helpful,
mhm,
or maybe like
mhm,
a self-realization.
mhm, mhm,
But it's interesting that you say that because what do you do when you're dealing with a client who might be in a very strong denial, or they're not ready to kind of confront this relationship was unhealthy?
mhm.
Yeah, I'll leave it at that. I'm thinking of parents, but
Yeah,
but
yeah, they're definitely.
yeah, but and then I really want to touch on supervision. That's such a great thing. But yeah, what is it like for you, like dealing with that in session with an individual?
Ooh, it's hard. It's really hard. I think one of my professors, I think my second at my during my second field placement, I was really kind of distressed by different experiences around confrontation where clients would say they're ready to hear things and it would be something similar around like their parents are abusive, and they're not necessarily ready for it. And so I had this question in one of my courses, I think it was like family therapy. I was asking my professor like, how do you deal with confrontation when it's like clear that what's happening is harming the client? And they're also here for my support. And I also see it. So what do I do when it feels like that confrontation should happen? Um, and I've there was no clear answer. It felt very much based on the therapist's intuition, but also what was the best advice I received was you can always kind of like slowly back out of the confrontation, which has been really useful in my practice around clients who are in denial about their relationships and particularly when it is abusive behaviors of noticing the different body language because so much of the communication is happening non-verbally. And so I'm paying attention to what's how they're responding to even just a slight confrontation of like, hey, you said these like this gaslighting behavior was happening and these different behaviors are happening. It sounds like this should be a abusive relationship. What do you think about that? And some kinds of like, no, that's not what's happening. I'm like, okay. And then like pivot into something else because I think sometimes clients, especially information like that, it can be so distressing and it also can cause a rupture in a therapeutic relationship.
Mhm.
And so I always think about, is the relationship strong enough to contain this if it ruptures? And that feels very present in my mind when I'm thinking about confrontation.
That it's interesting too. I'm thinking about something in regard to supervision as well when you talk about after you've worked with the individual and now you're in, a supervision and we're talking about what's coming up for you in the session.
Mm-hmm,
So,
mm-hmm,
one thing that was coming to my mind that I wanted to point out was really interesting. I do a group supervision with me and the other clinical intern and a licensed clinician. And then the licensed clinician was telling us about how she had this client who would describe what was many different forms of child abuse, but they were really out of touch with that's what that was. And it's interesting because the clinician then asked the client had a child, and the clinician says, "Would you want your child to have your childhood?" And there was such an immediate reaction, and that was kind of the end of, this is maybe this relationship was atypical. When in your supervision, when you're talking about what's coming up for you in session, could you share a little bit about like what does come up for you sometimes when you're hearing these things?
Um, Definitely my own experiences. Like I'm also a survivor, um, of different forms of abuse, but of child abuse. And so I think particularly when I'm dealing with survivors, there's I think a higher chance of activation and for things to be coming up like countertransference to be experienced. And so it also feels so important. Supervision feels even more important in that. But also having my own therapist to also talk about because there's a limitations to what supervision can provide. But I think it offers me an understanding sometimes uh, of something I couldn't see. Like for example, I had a session with a client where there felt like this feeling of like hopelessness. And it that is a feeling that activates me. And I noticed that I was feeling more withdrawn and it was through supervision that I understood that the emotion was hopelessness that I was experiencing with the client, or the client was experiencing. And so when I went back to the client, I was able to use that countertransference as a way to guide our sessions, and it was an opening. They were like, I was not hopeless, but I could see how you thought that. Was like I kind of was slightly despairing at this particular thing, but then it opened us up into really understanding what was happening for them and also reaching backwards to understand where that feeling of despair began. But I think being able to talk about my own experience in the session with my supervisor allowed me also to support my client, but also support myself to understand that this is something that happens for me and also something I need to work through. And so I just think supervision is invaluable to our education, but also to our skills as therapists, but well being also, just overall well being.
That's really, yeah, that's really good to hear. I think for someone, I'm thinking selfishly now, for someone who's like new in the
No, go
field
ahead.
and is learning and very new and is learning these things,
Mm-hmm.
I think for me, there was such a hesitation to bring myself into session. It was like, because the grad school approach is very much like to be very boundaried and very strict with that. And so I think
Yes.
my first couple of months, I was definitely, things would come up for me. And I would say, no, we have to be very
Mm,
boundaried. And kind of what you're describing as you kind of get that permission to say, hey, what if you bring this up in session? And it's interesting that you say that because I had a similar experience. It wasn't with hopelessness, but it was with a client that I was really, there was some countertransference there.
mm,
And I had to just be honest in session and say, hey, let me just tell you what's coming up for me when you say this to me. And I want to hear what your reaction is. And that opportunity really allowed us to have a really constructive discussion.
mm,
And it ended up being like a really impactful session for them, I think. Um, when you, how, so I want to ask about, you mentioned like attachment theory and you mentioned things like that.
mhm, mhm.
I'm sorry I keep going back to me, by the way. You're bringing up things for me, and I'm like, I have to share this.
I love
Um,
that.
so I'm curious about what your thoughts on or what's coming up for you when I mention the early relationships in our life and how that impacts our mental health as adults.
Mm, mm.
And yeah, I'm curious about just the initial phrase, is if anything's coming up for you when I'm mentioning that.
I think it's so essential also for how I think about therapy. I think also from a psychodynamic perspective, because I feel like that's a lot of where I'm pulling from in my therapeutic practice, of that our initial relationships inform all relationships that follow. And in terms of attachment theory, that the attachment relationship, the initial attachment relationship, creates a secure base potentially for clients or for children to explore, but also to emotional and psychological development and emotional regulation. But when it's not a secure relationship, that also has a long-term impact. And clients are more likely to not be happy, interdependent, and resilient adults, and within their relationships because of that initial wounding, is what I call it. And so I think it informs everything. And sometimes it's really hard because I've had clients who came in and were like, I don't want to talk about my family at all. And in the initial session, I had to say, so my practice is that we will have to talk about family because I reach backwards to understand what was the initial experiences that are informing your present world and also creating this distress. And so I've had clients say, okay, I think I could do it, but no one's phrased it like that. I thought I just had to talk about my family and keep talking about them and nothing changes. I'm like, no, I hope that that's not what we do. My intent is for us to begin to process things you couldn't when you were like 3 and you just had to adapt, but the wound is still wide open and expanding because of the repetition and relationships and experiences because it's unresolved.
Again, something jumped out of my head. It was so funny. I had a client who we do like call, if we get a new client, we will call them like typically 24 to 48 hours before just to introduce ourselves. Um,
Nice.
and the client said to me, I was like, yeah, I'm going to be working, we're going to be working together, whatever. And he goes, yeah, I really don't want to talk about my mom. So I just want to like, throw that out there. And I said, okay. But I got off the call and I immediately texted my supervisor and said, this is what happened. And I know that we're going to have to talk about mom. Um,
Mm,
because this
mm.
client was very specific. I don't want to talk about mom. And I'm like, that means we need to talk about mom.
That's exactly
Um,
what we need to talk about.
yeah. And so I left it for a while, but eventually it came up. But I'm curious about like your ideas, like unlearning harmful relational patterns, because I think
Mm,
when
mm.
we get into like maybe a certain attachment style, or we get into a certain attitude with relationships, or we kind of like, come into adulthood and we have these tendencies maybe that might be left over from childhood, or, some behaviors that we're doing that may be self-sabotaging in a way. What does it look like for you working with clients to unlearn those behavior patterns? Where does that start with you? Or yeah, where does that start with you? What does that look like?
I am such a like this the relationship. Because I also my supervisor before my current supervisor was a relational therapist, and she taught me so much. Like when you said that you were like hesitant about bringing yourself into the room, I was that way for the first 2 years of my internships. But she pushed me to say like, it's the relationships that can hold so much and teach so much. And from that, I grew and as a therapist. And so what I like to do is utilize the relationship as a way to teach better ways of relating through building trust. Like we're building trust, open communication. Like I'm going to tell you what to expect as far as I can know, and also let you know what I don't know. And so just being open and communicative and transparent, but also encouraging self-compassion. I feel like that does so much good and transforming unhealthy behaviors into healthy behaviors. Of clients being able to recognize that that was harmful for them and in relationship, but also they can be compassionate towards themselves and acknowledge that that was how they adapted as a child. But now it's very much inappropriate, and it's hurting them and the people who are close to them. And so, understanding and having that compassion also allows transformation. Patience is such a virtue because their clients, I immediately be, and I am seeing a lot. And I'm like, okay, that is controlling behavior, but also you're, it, they can be at a place where more kind of like reflection that can be seen as negative, like they can't tolerate it. So it's like it may not be helpful to say that in that moment, but it's like bookmark. Let's try to meet this with compassion and also understanding like, hey, boundaries are self-protective, not to control people. So like also psychoeducation plays a big part, I think, in helping change harmful behaviors because it also I got in some way depersonalizes the behavior, and allows clients to kind of see from like, oh, okay, theoretically that's what it looks like, but then they can somehow also integrate it as we begin to talk about it, and they can see themselves as not necessarily a bad person, but they can see their behaviors as unhealthy and negative. Um, Curiosity feels like really important. Also, driving, I'm curious about clients because I will never know them completely, but I want them to be able to know themselves in that way. And so I think to constantly push curiosity rather than like self-criticism, feels really, really important. And then non-judgment of like, I'm not here to judge you. I'm here to support you, but I'm also here as someone who is also will confront when behaviors are not okay, but isn't going to make a judgment on you as a person because of those behaviors, but acknowledging that that is not healthy. Um, and I think validation feels really, really important, especially to trauma survivors. I feel like I've noticed a lot with trauma survivors that there's so much fear of being misunderstood and invalidated that it feels really, really important to acknowledge how they're feeling, even if the behaviors can be negative, to kind of acknowledge the emotion while also saying, like, this is not a healthy way to respond to what's happened. So it feels like a very delicate balance of like affirming, but also not enabling. And so I think that feels like a lot, a lot of things I've said. And I feel like I still have a longer list, but I feel like those are really, really important aspects of trying to support clients towards healthier behaviors and relationships.
You brought up something interesting that I became curious about, and when you were saying we kind of look at things with clients, and we can, maybe it may not be the right time to confront right now, but it's something to note.
Mm-hmm.
And I was
Mm-hmm.
thinking about kind of like we talked about countertransference earlier, so that's been on my mind. I'm wondering, when you in sessions, if you hear a client that says something that maybe you fundamentally disagree with,
Mm-hmm.
how does that show up for you in session? And I'm thinking,
Mm-hmm.
yeah, you pinged something earlier that I was like, I'm wondering about that, because of course our clients, the people that we work with, are people that have their own opinions that are different than ours. But I think we're in an interesting, I'm not going to go for politics, but like we're in an interesting political sphere, right, where we have some confusion about what is an opinion versus what is maybe something that some people see as fundamental. So I'm curious how that shows up for you in session. Maybe if you hear a client say something that you are like, maybe you fundamentally disagree with.
Oh yeah, that's happened numerous times. And I think earlier in my like therapy experience, which I'm still early in, so it's so funny to say earlier, but was really hard because I feel like I'm a very principled person and I have like these strong political values. Like I think we're political people. What is personal is political. And so it was really difficult. I um trying to also value like not impose my values onto my clients as well as acknowledge power. Because I think in social work programs there's such an emphasis on power and oppression, and so it's at the same time it's also like client centered. And so it's like, what if the client has oppressive behaviors or worldviews? Like how does that come up? And I think once again the relationship feels so important, that if the relationship is, we can build that rapport and create that therapeutic alliance, then it can contain these difficult conversations. And I think what I've encountered a lot, particularly when I have male clients, is a lot of like misogyny. And it can be so casual. At some point, I was like, I don't want any more straight men, specifically. Like, no.
There's a
This is a show.
clinician in my practice who doesn't take straight men.
I respect that because it can be so distressing to
Mm-hmm.
literally hear them complain and then next word there's like calling a woman a bitch. It's like, whoa,
Mm-hmm.
whoa, that's a bit much. And so I've also I I've also sometimes been like, okay, let's process this. Or they're telling me an argument they're having with a girlfriend, and I'm like, oh, yeah, that's not what you said wasn't okay. And so I think that my responsibility, I think this is the place where social work gives me so much to lean on, where it asks for me to also think about social justice. And so there's also this kind of obligation to disrupt these systems of power. So when, like, for example, misogyny is coming in the space, it's also to say, hey, like, these beliefs are misogynistic, but in a way that is digestible to my clients and also doesn't immediately bring up defenses. It's like, let's talk about this, and understand how this is harmful and what it means. And clients are really receptive. And I have clients who we're going back and forth. To be honest, I've had clients where I realized how activated I was, and I was like, ooh, the clinician I am now would not have necessarily done it in that way. But I had really positive experiences where clients are like, I have to sit with what you said, and have circled back and have been like, I talked to my friends and they said I'm a little bit of a misogynist. So I think I can sit with what you said to me around like these behaviors that I have about the nuclear family and men's responsibilities are kind of archaic, but also harmful to women and non-men. And I can sit with that. So I think what always mattered in the end was the relationship. And so the ability to have built that alliance allowed the places where our values were misaligned And it was about oppression and power to actually address it in a therapeutic way. And also to see how, like, for example, where clients where I have queer men who are saying these things. It's like, hey, this is hurting you and your partner actually right now. This is coming up in your relationship.
Yeah. I wanna
Mhm.
bring something up.
Mhm.
So, that you mentioned queer men,
Mhm.
because I have a client right now that I'm thinking about who we were having this kind of discussion. I'm actually curious about your opinion on it.
Yeah.
So, we were talking about how, and if you're listening to this and you're not prepared for terms then when it comes to, like, queer sex, then this would be the time for you to, like, skip forward or whatever.
Mhm.
But we were talking about this client that I have has these very strong, what I would consider, and I don't wanna get too hippy dippy, but, like, heteronormative ideals around relationships.
Mm. Mm.
And this is a gay man.
Mhm.
And so we talk about, and I love this client, but we talk about a lot of these heteronormative ideas and what it means. And so what we this one of the things we were discussing was the idea of bottoms and tops in relationships with
Mhm.
gay men, amongst gay men.
Mhm. Mhm. Mhm.
And so one of the things that we were talking about was how this idea that, like, the top is more valuable than the bottom, and that the bottom has to take on these certain personality traits, or has to be more effeminate, or has to, act in a certain way, is inherently misogynistic. And
Yeah.
that's what we were talking about. And this client wasn't really able, I had to really dig deep to, like, really get us there at how that relates to misogyny, because again it's like, oh well, it's two men, like how can it, what do you mean it can't be misogynistic if it's two men?
Mhm.
And we have this discussion about what that is and how it's not helpful to gay men, and how it kind of, like, perpetuates this cycle of, this is what someone who is, this is a penetrator and this is the penetratee, like these are the roles that they take,
Mm.
and the power dynamics that's associated with that.
Yeah.
I just said a lot. I'm curious about, like, your reaction, or what's coming up for you, or if you disagree with me, like, I would love, yeah, whatever your is coming up.
No, I absolutely agree with you. I think one client had a similar, like very divided roles in his household where he's like, I'm the top, I'm the breadwinner. He's a bottom, he's not. He just cleans the house, cooks the meals. I said, whoa, this is very, and this was a bisexual man, but his partner was a gay man. And so I think it was also hi- his his understanding. I was like, do you understand how you're also applying very misogynistic, also heterosexual dynamics into your very queer relationship? And how, like, the partner apparently would say, like, hey, like, I don't feel valued fully as a person. Which I'm like, oh, this is also what a
Mm,
lot of women say, and a similar kind of like placed in a like a stereotypical submissive role of feeling less human. And so like these kind of rigid roles and these definitions that also are not reflective of people's lived experiences and also the diversity in sexual experience. But when people are boxed into these places and these roles, that it deteriorates the relationship. And so I think I agree with you completely, but I also think it's a
so
difficult.
validating. Thank you.
You're welcome. Like it's a difficult conversation to have when we also talk about uh these systems of power outside of w- who it generically is supposed to fit with. Whereas like these are intra-community conversations, but also these systems, that's how far reaching they are. There's not a woman present, but still somehow misogyny has made its way into the dynamic, which tells you how insidious um patriarchy is, but also heterosexuality that is still trying to
Mhm.
weave its way into uh these dynamics and
Yeah,
these
and sometimes
relationships.
the queerest of relationships is.
Yes.
Mhm.
Mhm. Mhm.
That's
Mhm.
interesting. I don't know why this is coming up for me. but I want to touch on this for just a little bit. So my direct supervisor and I do a lot with kink as well. And
Mhm.
so that's a topic that we talk about a lot. It's a topic that I'm really interested in. But
Mhm.
and I don't know why exactly this was coming up, but it's interesting in kink relationships or relationships that have a kink dynamic or someone wants to play with kink when we are playing with power in a relationship
Mm.
and when we are playing with those dynamics.
Mhm.
And I don't know that that maybe is not necessarily related, but that was coming up for me kind of when we were talking about. Yeah, I was just thinking about some sessions that I have sat in with where there are couples that actively acknowledge misogyny and the heteropatriarchy and all those like fun keywords that we love to say in social work and
Mhm.
counseling, but and also playing with it and using power as a way to yeah to play with a partner. I don't know why that kind of was popping up for me.
Oh no, I think I see a connection definitely in terms of like where power is being asserted over people in these systems of power, where it's just you are vulnerable in these very particular ways. But I feel like in kink dynamics, the basis being consent changes how
Mhm.
power shows up.
There's a reclamation almost.
Yeah.
um, I want to shift just a touch about you mentioned you work a lot with transgender and gender nonconforming people,
Yes.
and we like touched briefly on their journey. And one of the things that's really interesting that I don't think people think about a lot is, and I want to get your kind of like input on this, is
Yeah.
this was actually a couple of years ago. I have a friend of mine who's a trans man who has all these really honestly like beautifully vivid ideas of what masculinity is. And we were talking, this was a couple of years ago, and it was just so interesting to hear him describe masculinity. And it really like it was one of those moments, where people have a growth moment where they're like, "Oh my god, I should learn more about that." And so I was thinking about one of the things that I don't think we think about a lot is how trans and gender nonconforming people have these really vivid and deep understandings of masculinity and femininity and you know and what that looks like and how that shows up. I'm curious about with your experience, what is that how does that show up in your work when we're talking about this I know it's very binary thinking, but yeah, I hope that is like clearly stated. I had never thought about, I guess as a man in society, right? Like I'd never
Mhm.
thought about, well, I had cuz there's, a lot of challenges to masculinity like when you grow up gay, but whatever. Like but this really deep intellectual thought that had to happen around masculinity for this person
Mhm.
that straight men, and a lot of men don't even think about. I don't
Yeah.
know. I'm curious about if anything's coming up for you with that or if I'm off base or whatever.
No, I think they're like trans people, transgender non-conforming, and gender diverse people have to rethink so much around gender expression and presentation that it calls into question things many folks have not called into question around masculinity and toxic masculinity versus healthy masculinities. Or the idea that we can, I think, transness as an identity, as a way of being, allows power and dynamics to be questioned in so many ways. And I think it's so revolutionary in the ways that we can reshape how we understand these different categories and also sometimes break those categories. Um, and so I think I'm I don't know if I answer your question, but I think it comes up in session, particularly a lot of clients are coming wanting to talk about their gender identity. And in the messiness, I like to say the messiness of it, and not needing to make sense necessarily. I think maybe they're coming in to make sense, or who are we making sense to also? Does it make sense to you? Um, then that is what's important. And how do you live in your truth despite what society says. I feel like that is a lot of tension that I have talking with trans people around identity, gender identity, is the struggle. As I would ask clients, like, what would you choose? How would you choose to express if you didn't have to think about the other? And they're like, whoa, I can't think about that. I can only think about the other. And I'm like, okay, so we have work to do here in terms of like, how do we get to where you're centered and how you can fully realize your identities despite how also violent these systems are. And so, because I'm also seeing clients who have these intersectional identities, they're not just up against one system. There's all of these systems. And so it's also allowing them to feel, not even allowing, I don't think I like that word. Like empowering them to feel like they have this agency to shape their world despite the realities that exist outside of themselves and to build resilience and community and that you're not the only one who is sitting in these questions and reshaping these categorizations. There's a whole community. And so also uh, supporting them and seeing the connection to other trans people because I'm also finding that a lot with my clients that they feel really isolated. They don't necessarily have a community that they would say they can talk to openly about their gender. Even as being out, trans people who have been moving through this world for years are still feeling disconnected from community.
Mm. And it's a really well to yeah, you mentioned earlier about I hope and I answered your question. I don't think I think I just said a statement and was like, what do you think about it? um but yeah, and it's such an interesting period in history, right? When trans people are so historically under attack right now. And yeah, it's really gross. But yeah, it's I really yeah, I really like what you said, and especially going back to just kind of this idea of discovering, if there were no rules in the system, what would you do? And
Mm,
if you didn't have to worry about this expectation, or you didn't have to worry about, you mentioned violence, and that's a huge thing as well. It's like,
mm,
that has to be taken into consideration is, there are a couple of people that I know that identify as trans, but they haven't begun transitioning. And there's a question that pops up amongst people of like, well, if they're trans, why haven't they started transitioning? And I'm like, that's such an interesting question to ask because that question, you haven't even considered the prospect of violence that happens
mm.
when someone is even suspected of being trans. And so, I don't know, we could probably talk about this for a really long time. Um,
We could, we very much
but
could.
yeah, there's so much there. And it's interesting to hear you talk about these individuals. And therapy is such a personal, intimate thing.
Hmm. Hmm.
And so to be able, and now I'm thinking about me again. I keep doing that. But I keep thinking about when I'm in session with people and the things that they're sharing. And I'm thinking about you mentioning how people are sharing these things in session with you and they're so personal and they're these inner thoughts about who I am, their identities, how they express themselves, and what a privilege it is to be able to kind of just sit there and to hear that and for them to like show up for you in that way. Anyway, a lot of things are coming up for me. I'm gonna
It's
have to like
incredible.
you're gonna have to send me a bill. Um, um, I'm curious before we kind of close, just to be
Mhm.
conscious of time. I'm wondering if there are a few things that you think people should know about your area of work, a few things that you think may be helpful for people to know. I don't know if anything's coming up for you in that department. Any like final like closing statements or thoughts that you feel like you wanted to share.
Wow, I have so many thoughts. And the floor is open. Um, I honestly, I think there's so many things to think about, especially on the therapy side, like for therapists to think about. I think I'm very much an anti-oppressive practitioner. And especially the context we're in, so many folks are being attacked. It's just the world is uh harsh. and our clients are in this world and oftentimes are coming from marginalized communities and experiencing this. And so I think it's our job as therapists to do our work to also address the ways that the system lives inside of us, the system. And I think you talked about it kind of in many ways throughout our like conversation about the ways that clients have helped you think about things differently, which also are challenging these systems that are trying to say that this is the way that it is and the way it has to be. And all of these folks are putting cracks into these systems of domination and power by saying, I think differently. I live differently. I want to live differently. And so I think about our responsibility as therapists to do the work. Like while our clients are doing the work, we also have to do the work. And so I think that's one thing. I think I really have to emphasize how, especially with work with survivors, that it's better to approach clients with the assumption that our clients are survivors or have trauma histories. And so like the things that are really useful for engaging with survivors is useful across the board, even if our clients turn out to have really healthy uh upbringings in childhood and early experiences, that they can be helpful in creating that safety and that openness and that collaboration and disrupting the power that exists in the space. Because I have clients tell me so many times, ask me from the beginning of like, hey, can you give me advice? And my immediate reaction is like, absolutely not. That is not my job. But also, I
Mhm.
will always say that this is a power relationship. And for me, it's unethical to give you advice because it I have so much entry into your inner world and your vulnerabilities. And also, I'm a human. I have my own inner world, and vulnerabilities, but also I have power in this space. And so it's also my job I feel that it's my job to equalize the power as much as possible. And that means that the places where I'm maybe offered more power, like giving advice, telling people what to do, is the place where I choose not to. Instead, offer all so many, not all, but like so many possibilities and support clients in moving towards where they want to be rather than what I want for them. Like there's no place I think for me in that to want something that is based in my own desires, rather wanting to support them in what I see being um being a part of that collaborative process of where they want to be. And so if I see like systems of precedents are coming up, and that's not necessarily something they named, but it's something that's impeding them from moving forward, then it is something we do work on. But it just feels really important to always think about power, especially in this moment in history, which is just so particular. And I'm very like astrology driven person, a spiritual person. So I'm like, the planets have not moved some of these planets in like 200 years, and they're moving in our lifetime. There's something
What's your
very interesting.
sign?
I'm a Capricorn.
Okay, I'm a Libra.
Oh, okay,
Mhm.
yeah.
You're like,
Love is
in
cardinals.
the call. Um,
I love Libras, so that is not going to happen.
okay. Um, it's interesting what you're describing. Speaking of theory, because we talked about that a little bit earlier. Um, it sounds one of my favorite psychologists is Carl Rogers, and so I feel like a lot of what you're describing is very Rogerian, very like no direct advice, very. I don't know. Are you having? Is there any reaction to that you're having?
Yeah, no, I support the no direct advice. Even though I know
Mm,
there's therapists who give it, and I'm just like that's a that's a difficult place for me.
mhm,
But I think we all have different practices. And I think if we're moving from a place of ethics and trying to support our clients, there can be a lot of diversity. But I personally don't like to give advice, even though especially the age group I primarily worked with before I moved into private practice was with college students who are asking for advice. They're like, I don't know myself. I need you to direct me. And I'm like, no, you do know yourself. We just got to reach it.
mhm,
So I'm going to help you reach it. So I think, yeah, I think hearing that also, I don't know so much about Carl Rogers, but I think
mhm.
I do like this framework and may do some research to see.
I love
Yeah.
him. He's kind of the founder of like client-centered therapy.
Oh,
Um,
okay.
so yeah, he has, there's a lot of like quotes from him that I really like, but he was like, I think the 60s and the 70s is when he kind of
Mhm.
was practicing mainly. And it's recent enough that there's videos where you can watch him like work with clients, but
Wow.
yeah, he was very client centered and very much like the client is the expert in their own lives. And that was kind of his shtick. Um,
Mm.
but I want to thank you so much for coming on. I want to thank you. Yeah, I want to thank you for your time, and I feel calmer now. I
Mhm.
do feel relaxed. Your voice is it's very calming. Did you ever listen to Delilah? Do you know who that
Mm-mm.
is? So it was this,
No,
maybe it was in the South because I'm from the South. I'm not, you're from Pennsylvania, right?
no, I'm from the South, but I think
Oh, you're
you're
from,
from the lower South than I
I'm
am.
from Georgia. Yeah, I'm from like South Atlanta. So there was um this person on the radio, Delilah, and she had this very soft voice and it was very calm and it was like a jazz kind of um like program. I don't know, maybe someone will know what I'm talking about, but their voice was so soft and she was very calming and it was always in the evening, so it was like very relaxing. Anyway, I think, I don't know, your voice is very relaxing in that way.
Thank you.
Well,
Thank you.
again, thank you so much for coming on. I really, really appreciate your time and your conversation. And yeah, I'll link some stuff about where to find you and all that. Thank you. Thank you. Thank you.
Perfect. Thank you for having me.